After a full day of debate, the House narrowly passed a health care reform bill late last night. The final vote, 220 to 215. And last night's debate included some contentious moments, like when Republican John Boehner asked Democrat Charlie Rangel about supporting an amendment to the bill that tightens a ban using federal funds to finance abortions.
And in conference, do I have your guarantee that your vote will be in favor of the Stupak language?
Well, I haven't normally cut any deals with you as a Republican, but why don't you talk to someone on your level in the House leadership, as you have in the past?
My time, Mr. Speaker. This is exactly
so rude. Why would you be so rude? You asked me a question.
And the
gentleman reclaimed his time.
Shame on you.
It's exactly the point I've been trying to make.
And joining me live now from Washington, D.C. is Republican Congressman Michael Burgess of Texas. Anna, good morning to you, sir. Nice to see you again.
Good morning, Alex.
Oh, so that abortion amendment in the bill passes. Some suggest it might not make it to the final bill. What do you think? Will this amendment survive?
It's really hard to know, and it was startling that Leader Boehner could not get a commitment from any of the three chairmen on the Democratic side about what happens in conference committee. You got to believe that this amendment is definitely at risk when this thing goes to conference, if the Senate passes a bill, which is also problematic.
Do you really think it's problematic? You really don't think the Senate's going to put something together and get it to the president's desk before the end of the year?
We passed a climate change bill in June, and the Senate has yet to take that up. And the reason they haven't is because of the backlash that House members got when they went home over the July 4th recess. It will be interesting to see what type of backlash House members get over the Veterans Day recess as we go home to our districts this next week. The American people did not want this bill, and it's been pretty evident for the past couple of weeks how they feel about it. I suspect we're going to hear long and loud from our constituents back home.
Can you give me an idea of what was happening as the vote was ongoing? At what point, at any point, did you think it might not pass? How were GOP members reacting? Let's get the good stuff.
Well, it was a collective holding of one's breath, and you never want to celebrate prematurely on the floor because you'll just embolden the other side or encourage the other side to go ahead and pass their bill. So there was a brief moment there where it looked like they were stalled out, and it looked like we would have no Republican vote for the bill. I was encouraged by that. The final vote, they didn't pass it by much. You certainly cannot claim this is a bipartisan effort, and it's again, it's on life support as it goes over to the Senate.
Except that, as you know, New Orleans Republican Joseph Gow voted for the bill. Were you surprised by that? Joseph
has a unique situation, and if any Republican vote was going to go for the bill, obviously Joseph was the one that we were all concerned about.
If this final bill doesn't reach the president's desk by the end of the year, what is the fate of health care reform?
Well, I don't think it stops there. There are a number of good ideas that are out there on both sides. I think the startling thing to the American people is that we started with a mindset shortly after the election. We have not deviated from that. People think we're going way too far into areas we don't belong. Many people feel that the mandates, the individual and employer mandates in this bill are unconstitutional. So we'll just have to see where it plays out. I think again, the Senate has never been known for its courage, and we'll see what they do in the weeks and months ahead.
That said, if it does make to the president's desk, it is signed and it's implemented into law. Do you worry that Republicans will be seen as obstructionists?
No, look, here's the thing. There's none of these programs. If people think they're going to get a government giveaway, well, nothing happens for 4 years as far as the benefits in this program, but the taxes start the first day that it becomes law. So there's some problems ahead. And remember that this 2,000-page bill has to be turned into rules and regulations over at the Department of Health and Human Services. We don't even have the head of the Center for Medicare and Medicaid Services. That person hasn't been named yet. That office has been vacant since Inauguration Day.
You make some good points. As always, Republican Congressman Michael Burgess of Texas, thank you so much. And for more on